Welcome to the Griffith Asia Institute Conversation Series. Greetings from Brisbane, Australia. My name is Robin Roberts. My colleagues Sara, Davies and I are leading an ASEA-funded project, COVID-19, Gendered Risks, Impact and Responses in the Indo-Pacific. Today's webinar will focus on 3 case studies from this project. Myanmar, Papua New Guinea, and the Philippines are the countries. As is our tradition, we start with a welcome to country. In the spirit of reconciliation, Griffith University acknowledges the traditional custodians of country throughout Australia and their connections to land, sea, and community. We pay our respect to their elders, past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. Thank you. Today's webinar, we will be using the Q&A function to engage with our speakers. You can start by entering your questions from the first presentation. We value your questions as an important part of today's discussion, the same as if we were in the room together. Please paste your questions in the Q&A window and our facilitator will attempt to address as many as possible in our session following the presentations. I will now hand you over to my colleague, Sara Davies, to provide an overview of the project and introduce our fantastic speakers from abroad. Thank you.
Thank you, Robin. Greetings, everyone, and welcome from the engine. In agriculture and food systems, women have experienced more discrimination and challenges than men, particularly in accessing credit, seed, and trade opportunities. A crisis on the scale of COVID-19, where lockdowns and border closures have caused extensive disruption to food systems and access to food markets, is likely to have created more challenges. But what were those challenges? And how did women manage during the crisis as it unfolded? This study has sought to investigate the challenges that women have experienced through hearing their experiences and perspectives during the COVID-19 pandemic in real time. In Myanmar, Papua New Guinea, and the Philippines, we have sought with our team to try and understand what has been the food insecurity experience and economic impacts on small-scale women farmers and women vendors. Through shared collaboration, fieldwork training, and data collection with our country team leads, we have sought to understand how these experiences relating to food insecurity and economic impacts have traveled through as the pandemic has spread across the region. As you will hear today, there are rapid and also long-term responses that are needed to address the long tail of COVID-19, as you will hear from our 3 excellent program country leads. I'm delighted to introduce to you the three country programs and their speakers. In our Myanmar study, we have Dazima U, General Secretary of the YWCA for Myanmar, and Yadana with the London School of Economics and London School of Hygiene and Tropical Medicine. For our Philippines study lead, we have Claire Samathu-Yoniko and Darlene Casado from the University of the Philippines, Visayas. And for the Papua New Guinea study, we have Naomi Wayengu, co-founder of the Huscook Initiative. We will now commence with the first presentation from our Myanmar country study. Thank you, Sinma.
Greetings from Myanmar and good afternoon, everyone. First of all, I would like to thank ACIER and Griffith University team, Sara, Robin, and Tracy for giving our Myanmar team an opportunity to participate in this research, which has been a rewarding experience. Meeting the women, listening to their stories and challenges are thought-provoking. I would also like to thank my 2 research leads, Whitney and Sahe, together with 2 research assistants, May and Sablu, for their contribution in the fieldwork, Yadina for assisting us in the data analysis. Today's presentation will give you the background of the research, methodology used, research experiences, and research insights. In terms of Myanmar case study background, is that during the research, Myanmar experienced both COVID and the coup. On the 23rd of March 2020, we have first confirmed case followed by nationwide lockdown. And on the 1st February 2021, there was coup with a one-year state of emergency declared by the curfew, followed by the curfews and movement restrictions nationwide. For the research, the targeted zones selected were Ayeyarwady, IWD, and Central Dry Zone, CDZ. Ayeyarwady is a coastal region center for rice production, and Nargis cyclone devastated the region in 2008. As for the Central Dry Zone, CDZ, the livelihood of people depend on irrigated agriculture such as groundnuts, sesame, sunflower, lentils, and seasonal flowers. So the field research was conducted during July to August 2021, the most challenging period, especially for the vendors with COVID third wave and the movement restrictions. As for the research methodology, we use in-depth interviewing, collection of stories of 50 women vendors and farmers, 25 women in each target zone with 2 research leads. Women were reached out through IWCA networks. They were interviewed, their stories are transcribed, translated, and analyzed accordingly. The in-depth interviewing collection of women's stories covers 5 themes: food access and affordability, expenses, care burdens, decision-making, and future planning. So what are the experiences? With the current political turbulences, women were reluctant or not comfortable to talk with us, but as seen in the photos, we co-created a friendly space with the support of white sisters there to listen to their stories and their sharing. It was found that although the post-coup situation had a great impact on the livelihoods of women, they were adaptable, adjustable, keeping the spirit strong to move on with life. They are hopeful for better times to come. For both women, farmers, and vendors, they share their experiences as they had to make adjustments in their daily diets, like less meat, more veggies. They didn't have access to essential medicine because of limited access to healthcare services. They experienced increased price of food items and farming supplies, such as the increased price for fertilizers, pesticides, seedlings. And women farmers also have experienced limited access to irrigation, water, climate change, unusual pests. For example, unusual pest infestation, for example, the invasion of snakes in their farmland. And thus farming practices change and farming areas also reduce. For the vendors, with the lockdown and restrictions, they experience decrease in demand at the market. They couldn't sell enough goods to recover the principal investment money they had borrowed in the morning. Both women, farmers, and vendors experience challenges in access to financial resources. There is limited access to income support from the government, and thus women had to pawn their assets to survive, to continue the small businesses. So finally, what are the insights from the research and the suggested actions? My colleague Yetana will present the insights from the research. So may I invite Yetana to continue the insight session? Thank you.
Thank you, Dr. Zima, for inviting me. And in terms of the research insights, we have found that women have different coping strategies to solve the financial challenges. They are either taking loan from the saving and credit groups, they pawn their properties, or they mortgage their land and property. And many women express that they have uncertainty about their future and their children's education and their business activities. And during the COVID-19, many schools closed down due to the restrictions, and there was an increased care burdens upon the women. And as my colleague Dr. Zima mentioned, that there are leftover and rotten produce due to the reduced demand in the market, and that women income is also reduced during the COVID-19. So for the insights, we have came up with the 6 insights, and then we categorized into the immediate needs as well as the long-term needs. For the immediate needs, it is the need for the women's safe space to come together, to talk and open up, and also to share the challenges and then the barriers that they face. And as in the findings just presented, women expressed that they are worried about their children's education, they're worried about their business, and they're worried about their health. So it is important for women to have access to the mental health and psychosocial support. And the last point of the immediate needs is the need to set up the self-help groups, for example, like the small business skills development for women to share each other, like the knowledge transfer. Like some women have the experiences in overcoming the challenges in terms of like pests and also marketing, and in these small self-help groups that they can share these tips together. As for the long-term needs, the first one is the introduction to appropriate technology in agriculture. Only a few women said that they had received some form of training related to the agriculture techniques. So it is important for women farmers to have access to the appropriate technology in the agriculture. And many women said that they have access to the microfinance institutions where they can save money as well as to borrow money. But since the COVID-19, they could not continue saving due to the financial situation. And only a few women and households said that they received the financial support from the government in terms of COVID-19. So these findings point out the need for the financial inclusion of women. And the last insights from our study is, as you all may know, that Myanmar is now under the double burden of the COVID-19 as well as the military coup. In this kind of situation, it is very important and crucial for women to have access to disaster and business risk management trainings. So these are the findings from our research in Myanmar, as well as the insights from the research findings. So thank you so much, Dr. Zinma, for the presentation. Yeah.
Thank you so much, Dr. Zinma and Yadana, for your excellent research and also your insight today. I just would like to remind you that we will be taking questions at the end of all 3 presentations. So please feel free to begin entering your questions into the Q&A function now. It's perfectly fine for you to enter them as you're thinking of them. Now I'm delighted to present our second team, the Philippines country study. Thank you very much, Claire.
Good afternoon, everyone. Today, I am tasked to present the experiences of Philippine female farmers and market vendors during the COVID-19 pandemic. I am Claire Samantha Wanico, and I am humbled to be given this opportunity. The overview of my presentation is as follows. I'll introduce my country and give a little background on the COVID situation here. I'll describe the methodology. I'll share the experiences of the female farmers and market vendors and our team's insights on this. Next slide, please. The Philippines has approximately 13.32 million hectares of agricultural lands that contributes to 9% of the GDP of the country. The major agricultural products of the Philippines include rice, banana, corn, and coconut. When COVID-19 hit the Philippines, the government declared the state of public health emergency to address COVID-19 by March 8, 2020. One of the measures that the government implemented to stop the spread of COVID-19 is the imposition of lockdowns. Lockdowns can be classified according to community quarantine status, the most stringent of which is the Enhanced Community Quarantine, or ECQ. In ECQ, there's no movement and establishments are closed. Aside from this, the government advised the public to practice hand washing, wearing of face masks, face shields, and social distancing. The government recognized that food is an essential need, such that food pass are given to assure the movement of food and agro inputs. Markets were also opened for reduced number of hours. By May and June 2020, the restrictions eased up. Next slide, please. Griffith University tapped us to facilitate the inclusion of the voices of women through semi-structured interviews in 2 provinces of the Philippines. These provinces are Iloilo and Antique. The study areas in Iloilo are Dumangas and Cabatuan, and in Antique, it's Sibalong and Hampik. These study areas were chosen based on the proportion of male and female farmers and the geographical proximity of these areas, given the travel restrictions and the spread of COVID-19. We requested for the data from the regional office of the Department of Agriculture, and we coordinated with the Municipal Agriculture Office for the list of the female farmers. And the MAO connected us with the Municipal Economic Enterprise Development Office for the list of the female market vendors. We conducted 26 female farmer interviews and 25 female market vendor interviews. Farmers were interviewed at their homes, or they were requested to go to open areas by schedule. Vendors were interviewed at their stalls to prevent disruption of business hours. Transcripts were analyzed by classifying their responses according to the themes of the questions: food access and affordability, expenses, care burdens, decision-making, and future planning. Answers were further probed, and we took time to identify the effect of gender roles to their answers. Next slide, please. These are the experiences of our respondents, and among these experiences, we would like to highlight 4: creation of satellite markets, difficulty in transporting produce, burden of additional expenses, and support for market vendors. Since the travel restrictions limited the movement of our respondents to buy their food, some LGUs created satellite markets. Satellite markets can be mobile or stationary, such that there's a schedule for every barangay, so that there would be limited time for people to be in contact with each other. Then our respondents find the prices there still expensive. Some market vendors supplied these satellite markets. Aside from this, some LGUs bought the produce of farmers so that they could distribute it as food assistance. In difficulty of transporting produce, a farmer noted that they cannot demand for higher prices for their products because they can't send their produce outside of their municipality. Our respondents identified several additional expenses. For personal protective equipment, or PPE, they find it expensive and they try to buy in bulk, and they ask others to join in buying so that the prices will be lower. Or they buy portion by portion from sari-sari stores. Violations of COVID protocols can be an additional expense because the penalties are fines. Internet is also an additional expense for our respondents because this is in support of the modular approach to the education of their children. Their children need to access online classes, or their children need to find the answers to their homework in the internet. For the support for market vendors, there were hardly any support for market vendors reported because, as one of our respondents said, they were not considered as severely affected financially by the pandemic, but they were prioritized for vaccination as a 4 priority group. Next slide, please. Based on those experiences, here are some of our insights. Vendors need additional support to sustain the capital for their stalls, and they need more customers. In access to low interest finance, there may be cooperatives for farmers, but they still resort to loaning because the farm inputs are expensive and the farm gate prices of their products are low. For market vendors, they resort to lending from Indian lenders because it's easier for them, but the interest is high. And most of our respondents see vaccination as a means to protect themselves and a step towards conducting their businesses safely. They even want some of their family members to be vaccinated too. Our respondents need psychosocial support because prior to the pandemic, they received this by participating in associations. But nowadays, because of the pandemic, they cannot have face-to-face interactions. One of our respondents also faced domestic violence, so she needs psychosocial support. For the long-term needs of our respondents, they need continuous agricultural subsidiary support. For example, they may be given an option to avail as much farm inputs as they need, or they need more tractors to be shared among them. In the improvements in the transport of produce, since there is limited customers for the produce of farmers in their locality, transport of their products can be facilitated such that they could have markets beyond their town and province. In one of our study areas, the respondents recognized how the travel restrictions impeded the goods they need from another island. To aid in the COVID-19 recovery, there may be a need to increase the number of agricultural extension workers that could facilitate the programs for farmers and market vendors. This ends my presentation. Thank you very much. And I would like to take this opportunity to thank my team and Darlene, April, our transcribers and translators, and Griffith University and ASHAR. We welcome your questions.
Thank you so much, Claire. And yes, Claire and Darlene are going to join us for the Q&A after the presentations. Thank you again, Claire, for that insight. Again, it's wonderful to see you posting questions already in the Q&A function. So please feel free to start posting now. Our third and final presentation is going to be from our Papua New Guinea country study lead. Thank you so much, Naomi.
Thank you, Sarah, and thank you so much. So with the Papua New Guinea study, in terms of the overview, I will, like the other partner researchers, I will be providing an introduction to the background of the country, Papua New Guinea, the background of our, background of our research, the method, sharing the experiences in the fieldwork, as well as the insights gathered throughout the research. Now, more than 85% of Papua New Guineans predominantly engage in agriculture, either as commercial or subsistence farmers. And so what happened to us last year when COVID-19 hit, it happened that on the 23rd of March last year, there was a lockdown that was declared, a state of emergency that was declared. And so the country went into the first set of 2 weeks of lockdown. However, the business center for most of our farmers and our local vendors, which are the marketplaces, had gone into a lockdown for more than 3 months. And then due to negotiations that happened with leading partners on the ground, such as UN Women, they were the ones that went into negotiations with the government to uplift some of the restrictions that were surrounding the operations of marketplaces. And so the restriction to operate markets were open in June So the farmers and the market vendors were then able to go back and do business. But the recovery process of the farmers and the vendors going back into business wasn't that easy. And so that was the situation that happened in terms of our farmers and the vendors, who were primarily the people that we have spoken to throughout the research and them sharing their experiences. The methodology that was used through the research here in Papua New Guinea, unlike Myanmar and the Philippines, we had used focus groups, and this was primarily because of the context, and also because of the uncertainty of the COVID situation that we had experienced in the country. And so the tool or the methodology was around focus groups, and we conducted two sets of focus groups in 4 target provinces, and those 4 provinces are Madang, Eastern Highlands, which is Goroka, Milne Bay Province, which is Alatau, and East New Britain Province, which is Kokopo. And in those 4 provinces, we had 2 focus groups, each reaching at least 75 vendors and farmers together in those focus groups. And on this note, I have to thank the 3 research assistants that aided and helped me throughout this process. Pamela Krisimpa in Goroka, Nicole Dagalio from Alatau, and Rachel Tikan from East New Britain, who helped facilitate most of this focus group and the research throughout this time. In terms of our experiences with the research that was conducted here, initially when we went out on the field, there was an assumption and also a doubt, given that there was a lot of misconstrued information about COVID-19 and how it was happening. And there was an assumption amongst the team that we would not be well received by the vendors or the farmers if we were to go and speak to them. However, the farmers and the vendors were really appreciative of the platform and of the space given to them to come forward and to share their experiences and their challenges that they have encountered during pre-COVID and also during and post-COVID. So they really appreciated that. Another thing also in terms of the experiences was that 2 of the 4 provinces, one located in the highlands and another in the coastal part of the country, have experienced extreme weather conditions. And so that means that their process of recovery from the hit by COVID-19 has been extended and is still currently an ongoing thing for them, because in one of the provinces, as we speak today, is still having the experience of drought at the moment. So the process of recovery from the hit by COVID is still happening. Another thing that it was also interesting and we noted was that food insecurity is an issue here in the country, in Papua New Guinea. However, the locals think it is not, but it was so clear, and the evidence in this research show that it is an issue. Just listening to the farmers and the vendors sharing how they had to sacrifice and go without food in some cases during the pandemic or lockdown, where shops were closed, movement was restricted. They first thought of themselves as mothers, so they had to sacrifice and provide for their children first before themselves. So it was really clear, and in the conversations around food security being an issue here. Thank you. Next slide. Now, in terms of our insights gathered through this research, we have some immediate and long-term, and I will just be highlighting a few. So in terms of our immediate insights, one of the key things that kept reoccurring in all the conversations that we had was around misinformation about COVID-19. And this really brought a lot of fear and panic into the households of the farmers and the vendors that we spoke to. And with that misinformation, there was also additional other information that made them not to sell certain produce, which affected their businesses as farmers and vendors. And so some of them stopped selling produces such as mushrooms and even poultry during the time of the pandemic and the lockdown here in the country. So the misinformation around COVID also had an impact on how the produce that they were farming or the poultry that they were looking after and selling, it did affect them as well. Another thing that came out very much in terms of us speaking to the farmers and the vendors was the resilience and the resourcefulness of the women throughout the pandemic, throughout the lockdown, and how they went about risking their own lives to provide and look for alternative business opportunities or alternative ways to provide and earn an income for their family during that time. And generally, they took so many risks. And as I mentioned earlier, some of them even went without food just to make sure their husbands and children were fed during that time. And in terms of one of the things in our long-term insights, and this came out from most of the farmers, especially those that are currently experiencing these extreme bad weather conditions in their provinces and trying to recover from COVID and also going back into that bad weather, was that there is shortage of seeds in the market, and there is no good competition at the moment. And so there was a request being made through this research that they need good seeds that can cope and withstand extreme bad weather conditions that we have here in the country, and also requesting that agricultural entities in the country not work in silos but work together so that it can help our farmers to get the seeds that they need as well as the support they need. Another thing that was also raised during this time with the farmers and the vendors especially was around upskilling their skills in agriculture and also with other skill sets that they may need because if there were to be another lockdown or if there were to be another extreme bad weather condition that would affect their farming and their production supply, they would need another set of skills, whether it be sewing or baking or something else, like an alternative business option for them. So this was one of the insights that came out very strongly from the women that we spoke through this research. So I think I'll stop here, Sara. Thank you so much, and I'll hand it back to you.
No, that's wonderful. Thank you so much for running to time today beautifully. So thank you, everyone. And thank you very much, Naomi, for your presentation. So again, we've had some great questions that have already come through. Could I kindly invite all of our wonderful speakers and project team leads to come in and show your faces. It's great that we've got our first question is actually across all three countries, which I think is a really nice way to address the sort of findings at the moment where we're at. So this one is around, how do you expect the situation for women to be changing over the next year, so in 2022? Is it likely that the hopes and dreams of a business as usual prior to COVID will be achieved or not? So I'd like to ask that our Myanmar team and then our Philippines team and then our Papua New Guinea team each answer this question, and feel free to take your time.
May I?
Yes.
So for the Myanmar team, I think now with the situations they are experiencing, their hopes and dreams, they still have hopes and dreams, and then the business can be, they may have to change or adapt to the situation. So and depending on the different situations, but they still are hopeful that they can move on, they can continue. So in our opinion, there are different, they can, adjust or adapt or change different businesses to continue.
That's great. Thank you. Yadana, did you wish to add anything to that, or are you?
Thank you, Dr. Sima. That's comprehensive enough. Just I want to also add an extra point is that, like we mentioned in our presentation, it's actually a double burden, right, of COVID-19 and COOP. So as usual, in terms of the question, it also depends on other conditions in the country, not only the COVID-19 situation at the moment in Myanmar. Yep.
It's wonderful. Thank you for that. And yes, that's been something that's always been in our minds the whole year through. So thank you very much. Claire and Darlene. And Darlene doesn't have a fan in front of her to create that fantastic rock star effect. She actually is in the field right now.
Yeah, I'm actually in an open field. I'm connecting from an island. So as you know, that Philippines is an island, it's an archipelago composed of many island countries. So I'm very happy that I'm here and also attending our webinar to share our insights. And maybe I'll just continue answering the questions so that after we, Claire will just add. I think it is really actually very evident that the pandemic really wreaked havoc to the livelihoods of the women market vendors and the our female farmers as consequences of the COVID-19 mitigation measures and even the mobility restrictions that were imposed until now, actually. But for the question, these hopes and dreams of the female farmers and vendors, such as their wish for good health, for them to be away from the COVID-19 infection, their wish for better future of their children as well as their education, their wish for thriving business and even freedom from debts are really served as their inspiration and their compass for them to easily recover from the impacts of the pandemic in all the areas of their lives, especially their businesses. And I think for them to transition and to easily recover and to easily reach these hopes and dreams, it is imperative for us, all the stakeholders and most especially the government, to design gender responsive programs and policies, to have small scale business sensitive programs and even equitable project interventions to forward the social and economic rights of our women farmers and women market vendors. That's it. Thank you. And Claire?
Thank you, Darlene. I would just like to add to Darlene's answer that if in the question here, if we expect that the situation for the women to change over the next year, in the Philippines right now, the businesses are slowly opening up. So if this continues with caution and there won't be an increase in the number of cases, maybe the situation of the women will change because, for example, they experience added burden by having their children stay at home and they have to be the teachers of their children. So if the schools will open up, then maybe this burden will be removed by next year. As for their hopes and dreams of business as usual, it would really depend on how we could address COVID-19. That's my answer. Thank you for the question.
Thank you, Claire. Naomi?
Thank you, Sarah. I would hope that businesses do resume back to normal for our farmers and our vendors here in Papua New Guinea. However, I must say that we, in terms of vaccination, at the moment, we have the lowest rates here in the Pacific. And with that being said, in terms of the operations of market spaces, which are generally crowded areas, and this is primarily the space for vendors and farmers, this will take a while for normalcy for the farmers and the vendors to get back into business. So maybe not so early as next year, because some of them, as mentioned from our findings, are recovering from extreme weather conditions. And those were just 2 provinces that we researched on. If we were to look at the whole country, we would find out that maybe other provinces are also affected by other things. And so, yeah, I would hope for the best, but I can't really say if it will go back to normalcy as early as next year. Thanks, Sarah.
Thank you for that. And I think this just really highlights perhaps the importance of us continuing to hopefully be able to do this research and to follow and to keep in contact with our populations that have kindly talked to us throughout the year. We've got a second question here, again, for all the presenters, which is wonderful. And this one is wanting to know, how did we basically provide that information on the insight slide that we all did? I think I know the answer to this one, but I'd be keen to get, again, let everyone respond how they feel best. Was this something that we have directly taken from conversations, so, verbatim, or did we think, or did we interpret what we think were the insights that were being presented to us? Again, may I please ask our Myanmar team to answer this first?
So Irina, would you like to take the question?
Yes, thank you, Dr. Zimmer. So for that question, of course, it's translated from the data from the women's words, like the verbatim, as well as expressed as needs. So I would say it's a mix, but it's more from like what women have expressed, what they need. Yeah, thank you. Please add more if you have addition, Doctor. Yep.
I think she has answered your question.
Claire and Eileen?
Hi. For the Philippine team, it's also the same as Myanmar's. It's a mix. So we may not have used the exact words of the respondents, but yeah, some were expressed by them and others were gleaned from what they said. Darlene, you might want to add something.
Yeah, I think Claire has already answered the question.
And similarly to my colleagues here from the Philippines, we also had the same thing for Papua New Guinea. Some were expressed and some were taken out. Yeah, thank you.
If it helps to provide this insight, and Robin, you can jump in too if you like. If you're one of the things that we were particularly keen, and we had a lot of discussions about this as a team, was in the transcripts which we have kept the quotes exactly as they were, and there's been a lot of discussions about how we did translation, and then and just to make sure that we captured the intent and the meaning. There was a lot of in-team discussions to make sure that everyone agreed on the way in which the reports were being we were reporting the findings. And then there was a lot of discussions then about how we would sort of identify the responses under those themes that we had, and what did we think we were being told that the individuals wanted. So there was a lot of collaboration and a lot of discussion about this, and we certainly, when we provide our report, will be detailing the way in which we've analysed and reported on these important conversations with our participants. Robin, did you want to come in?
Oh, I think it's all covered, but a lot of time has been spent on the translation and transcription area by the whole team. So we're all fairly versed at that now, but I think the report capturing the verbatim statements will provide that insight as well. So thanks.
So I've got another question. It's great to have so many questions. Thank you, everyone. This one is for our Myanmar team. So are the new coping strategies for women vendors and farmers completely new due to the pandemic? or had you seen some of these trends in previous years due to the ongoing natural disasters and political upheaval? So were these sorts of, I suppose it's two parts here. Did the women themselves identify these things as being new, or was this a continuation of a longer cycle of sort of upheaval that they had experienced? And I think this might be something as well that our other countries might be able to answer as well, because there have been natural disasters, maybe not necessarily the same degree of political shocks, but there have been natural disasters in our other countries as well. So if you'd like to answer this question as well, you may. So did you identify new coping strategies here? Did the women see themselves as having to adopt new coping strategies? Or was this something that they'd been quite used to?
Thank you for the question. So for the case of Myanmar, I think women are resilient, and then they are quite adaptable, and so they have different coping strategies. So their coping strategies are, are changing depending on the situation, depending on the situation and then the needs. So what we found in our research is that some of the coping strategies they've been using in the past, but some I think they have adjusted and adapted because of the situation, the new situation. So this is what we have found. So how about Yadina? Would you like to add also?
No, I don't have anything to add. Thank you.
Great. Would our Philippines or Papua New Guinea team also like to answer this question? Claire, I see you've come in.
I think in the Philippines, they did the same coping strategy. Like they diversified their income and they still resorted to loaning. However, I think something new would be some reported that they did online selling. I think that's something new. So in the advent of the internet, they diversified their income by online selling. I think maybe Darlene could add further.
Actually, they don't have any choice but to really cope up and find solutions on how to recover from the impacts of the COVID-19, since we know that everyone is also struggling, and it is also our first time to face this kind of pandemic. So for the female farmers and market vendors, as what Claire also mentioned, that most of them diversified their products. They also did online selling. They also resorted to what are the trends nowadays, which are selling plants, which we call here in the Philippines as plantitas and plantitos. So, so as what they have observed, what is currently trending in the market, so they're also resorting to that kind of products and strategies.
Wait, I just remembered something. One of the youth organizations help our respondents by, for example, since they are burdened by the education of their children, the youth org provides tutoring services for them. So that's one way of also coping with the demand for teaching their children. And that's it from us. Thank you.
Nothing from my end, Sarah. You can go to the next question.
Thank you. So we've got a question here about, for the Philippines in particular, and this is perhaps one that could apply to all of our cases as well, which is about, the fact that we've got a relatively small sample size. And so it would be keen, I suppose, for the Philippines team to respond to this, but again, welcome reflections from the rest of the team about the extent to which we perhaps feel confident about these experiences as being ones that are reflected across other locations within our countries. Thanks, Claire and Darlene.
Okay. When we were given the task to do this study, we were informed that this is another part of the whole study. So the other part of the study is food insecurity experience of COVID-19 survey. So it included a larger number of people, and we were just tasked to do the interviews. And based on our experience so far, 50 interviews are already a lot. And I think, I hope I answered the question. Darlene, would you like to add something?
Was there anyone else who'd like to come in on answering that question? Again, it's one that we discussed at length. And I suppose one of the things that we would have identified in this project was that it was about the fact that this was a mixed methods design. So we have a quantitative component, but we also have a qualitative component, and this was the qualitative. And we're certainly not claiming to argue that these experiences are ones that would apply to all populations across the country. But we do feel quite strongly that we have identified particular thematic continuancies across all three countries in terms of the types of experiences that farmers and vendors reported to us that they were experiencing by having these consistent themes that we had that informed our questions. But no, we would also agree that we can't claim that this is something that is universal, but we think it's really important to be able to identify a group of women whose experiences can sometimes be quite difficult to seek out unless we can go very local, sometimes very rural, and ask them what were their experiences. And it's also important to note too that we have a fair degree of different areas of literacy, as well as care burdens that were being experienced across our populations as well. And so we're actually incredibly grateful to these women who gave us their time and spoke to us. We also have another question. I think this is a great one about if we face this again. You know, we're not out of this one yet, but if we face a crisis like this again, what would you suggest? And would I be able to ask each of our country teams now to do that awful one, which is, you know, you've got one thing that you can suggest in the next crisis, and what would that be? May I ask our Myanmar team to speak first, please?
Thank you. So, as shared in the insight in our insights, the situation is not over yet, but to suggest the adopted strategies, one of the adopted strategies would be like, if we have a safe platform, a safe space for women, you know, where they can come together and just discuss the challenges and difficulties, I think that would help also. That would be one of the coping strategies. Yeah, thank you.
Claire and Darlene? Sorry, I don't know. So you unmuted, great.
No, I don't have anything to add. Yeah.
In the Philippines case, I think the system of having a barangay health emergency response team is a good start, and our respondents are part of that, but they need support. Like maybe add more members to the BHERT and help our respondents face the challenges of a pandemic. So for the benefit of everyone, BHERTs is like, if there's someone positive in our barangay, they will report to the BHERTs. Then the BHERTs will report to the local government unit. So at least everybody's monitored and they can implement the necessary policies to stop a pandemic. But yes, they need support, and the rules should be standardized. That's it from us. Maybe Darlene would like to add.
I think also it is high time for us to include pandemic response to our local development plans and programs. Actually, in the Philippines, we have every local government units have their local development plans, wherein every year or every 3 years, they are integrating all the programs and projects from the needs and the issues that that the communities are experiencing. So I think for example, the local government unit have this local disaster risk reduction and management plan, wherein 5% of the budget from the development fund of the local government is allocated to that. So maybe we can, the local government could allot fund financing or funding support for the economic recovery and for the livelihood recovery of our market vendors and female farmers, most especially that Philippines is an agricultural country. So we really need to have that kind of emphasis and focus to help them in the recovery and rehabilitation stages.
Naomi?
Sarah. I think I have two things to mention only here, and Darlene clearly explained one of them, which was around economic and agricultural recovery plans, and that would be necessary for our case here in Papua New Guinea, given what I've shared with the extreme weather conditions that have been experienced by our farmers as well. And as we know, if the farmers are affected, their production level is affected, that affects the vendors and their business as well. And so having that plan would be essential going forward if there be another pandemic of this nature or any similar forms. Another thing that I would also think, and this is also to our case here in Papua New Guinea, is with the request that the farmers clearly spoke about having skills not only in agriculture but other business alternatives that can help them, given if in a pandemic and then you have extreme weather conditions and you don't have good seedlings, you need another alternative to survive during the time. And so having that avenue of providing other business alternatives for the farmers and the vendors will also help empower them economically as well during such crises. Thanks, Sarah.
No, that's wonderful. Thank you. So we're coming near to the end, but we have time for at least, I hope, one question, perhaps two. And I think this one in particular is a really good one for us as a team, we're starting to put a bit of thought into this. I should add that our impressive group here have been trying to collect data during the Delta wave, during quite a difficult period for them individually, as well as, within the locations where they were placed. So they've very kindly made sure that we've been able to do this webinar today, but this next question is one that's uppermost on our minds, and that is, how are we going to report back the findings? So one of the steps that we've done today is this webinar, which is going to be freely available. But I'd also like to hear from our country team leads as well about their thoughts around this question, which is, how would you like to think about reporting back the findings within your community, as well as perhaps to policymakers, and what would you like to see done? And I know that each country has quite different experiences, Myanmar in particular, around how they're going to perhaps answer this question. Myanmar, would I be able to ask you to please?
I think for the reporting back, the report we can share with the women that will participated in the research, women and that communities. We can have a
I think she's disconnected due to the internet connection. Yeah, but to continue the conversation that Dr. Zema has said, that currently, due to the situation, all the ministries are not really functioning under the coup. So our plan would be to report it back and share the findings with the women who have participated in the interviews and also share the findings with the community. Yeah, that would be the way forward at the moment. Yeah, not really. With the policymakers, it's not really feasible at the moment. Yeah.
Thank you, Dr. Zinmai. And sadly, your internet cut out. Would you like to also follow up?
No, it's okay. Yadana has continued. So thank you, Yadana. The internet cut finally. So thank you.
Our Philippines team, thank you.
So I'd like to support Sara's answer a while ago. So we sent the invitation for this webinar to all the municipal agriculture offices in our region. And I also thought that to present the findings of our study in the National Gender and Development Conference of Central Luzon State University. So that's one way of sharing the results of this study. And I think Darlene already reported this as part of her output in the Center for West Visayan Studies. So that's it for us for now, but I think maybe Darlene would like to add something.
Yeah, as representing the Office of the Center for West Visayan Studies is also focusing on heritage resilience and even agriculture researches and research programs and topics. We are very happy and also very excited to share the findings and the recommendations that we have to our local agriculture offices here in our region, so that which will be also in time for the planning and the planning stages here in the Philippines. So because in every year there is an annual planning and budgeting for the local government units. So I think the recommendations here and the insights gathered from the reports will be very helpful and relevant in defining and designing responsive programs for our female farmers and market vendors.
Thanks, Sarah. So for Papua New Guinea, right after doing the field work, I've had conversations with several people in the agricultural sector, as well as other key partners, noting that there were different parts of the research that each one of those stakeholders could assist in. And so this information from my end and the team, we would expect to see it reach the farmers and the vendors through the research assistance that they have provided, and also to those key stakeholders that are working in the market spaces, as well as those working in the agricultural sector, to really help push some of the things that the farmers and vendors have requested and or asked for in terms of helping them recover throughout this process. So thank you.
So thank you so much, everyone, for joining us today. Sadly, we are out of time and we're unable to continue answering your questions, but we are going to continue to provide further information and insights about our project, including the recording from today, on our project website, which we will be providing in a screen share right now for you to be able to access. We would also like to sincerely thank the Australian Centre for International Agricultural Research for their support for this project. We would also like to note that you can visit one of our partners' websites, which is the Gender and COVID-19 Working Group. And you are always welcome to contact us, Robert and myself, through the email that's been provided on the slide now. But finally, I would like to give a warm thanks to our amazing country team leads, as well as the research assistants, transcribers, translators who have worked so hard on this project. It's an absolute, it's been a shining light in an otherwise quite challenging 2020 and 2021. So thank you everyone for joining us tonight, and have a good evening.
Thank you all.
Thank
Have a
you.
good
Thank
day.
you.
Thank you. Salamat from
Bye,
the Philippines.
From Myanmar. Bye.
Thank you. Thanks, everyone.